Hello, good day class. This is Ma'am Christine Weirhan again, and I'm here to discuss a supplemental topic about assessing the diffusion and perfusion when we take the respiration of our client. I would like to apologize in advance as I live in a very busy street, so you might be able to hear the traffic. So again, this topic can be seen in your Fundamentals of Nursing book by Potter and Perry, 10th edition, in pages 502 and 503. So let's begin. So when we assess the diffusion and perfusion of our respiration, we evaluate the respiratory process of diffusion and perfusion by measuring the oxygen saturation of the blood. Blood flow through the pulmonary capillaries delivers red blood cells for oxygen attachment. After oxygen diffuses from the alveoli into the pulmonary blood, most of the oxygen attaches to the hemoglobin molecules in red blood cells. Red blood cells carry the oxygenated hemoglobin molecules through the left side of the heart and out to the peripheral capillaries, where the oxygen detaches depending on the needs of the tissue. So the percent of hemoglobin that is bound with oxygen in the arteries is the percent of saturation of hemoglobin, or the SaO2. It is usually between 95 and 100%. It is affected by factors that interfere with ventilation, perfusion, or diffusion. So the saturation of venous blood, or what we call as the SvO2, is lower because the tissues have removed some of the oxygen from the hemoglobin molecules. So factors that interfere with or increase tissue oxygen demand affect the usual value of our SvO2, which is around 70%. So when we measure the arterial oxygen saturation, we use the pulse oximeter. A pulse oximeter permits the indirect measurement of oxygen saturation. The pulse oximeter is a probe with a light-emitting diode connected by a cable to an oximeter. So the LED emits light wavelengths that the oxygenated and the deoxygenated hemoglobin molecules absorb differently. A photodetector in the probe detects the amount of oxygen bound to hemoglobin molecules, and the oximeter calculates the pulse saturation. So the pulse saturation is a reliable estimate of the arterial oxygen saturation when the arterial oxygen saturation is over 70%. So a saturation of less than 90% is a clinical emergency. Values obtained with the pulse oximetry are less accurate at saturation less than 70%. So we know that a value of less than 90% is considered as hypoxemia. However, values below 90 may be acceptable to certain chronic diseases like asthma and COPD. So the photodetector is in the oximeter probe. Selecting the appropriate probe is important to reduce measurement error. Digit probes are spring-loaded and conform to various sizes. Earlobe probes have greater accuracy at lower saturation and are least affected by peripheral vasoconstriction. You can apply disposable sensory pads to a variety of sites, including the forehead, the bridge of an adult nose, or the sole of an infant's foot. Oxygen saturation measurements using a forehead probe is quicker than finger probes and most accurate in conditions that decrease blood flow. So factors that affect light transmission or peripheral arterial pulsations affect the ability of the photodetector to measure the SpO2 correctly. So unawareness of these factors allow accurate interpretation of abnormal pulse saturation measurements. So now let us talk about the factors affecting determination of pulse oxygen saturation. So first, let's talk about the interference with light transmission. So when we talk about outside light source, this interferes with the ability of oximeter to process reflected light. Carbon monoxide, caused by smoke inhalation or poisoning, artificially elevates oxygen saturation by absorbing light similar to oxygen. Patient motion interferes with the ability of oximeter to process reflected light. Jaundice interferes with the ability of oximeter to process reflected light. Intravascular dyes absorb light similar to deoxyhemoglobin and artificially lower saturation. Black or brown nail polish or metal studs in nails and thickened nails can interfere with light absorption and the ability of the oximeter to process reflected light. Dark skin pigment sometimes result in signal loss or overestimation of saturation. That's why sometimes when we go to the hospital or in the emergency room, sometimes what we need to do is look at the finger that we will put the probe on and try to clean that finger if there's any dirt or maybe blood or yeah, any dirt. So just use an alcohol if it's not contraindicated, or just water just to clean the finger so that the probe can read the oxygen saturation properly. So the other factor would be interference with arterial pulsations. So the peripheral vascular disease like arteriosclerosis reduces pulse volume. Hypothermia at assessment site decreases peripheral blood flow. Pharmacological vasoconstrictors like the use of epinephrine decrease peripheral pulse volume. Low cardiac output and hypotension decrease blood flow to peripheral arteries. Peripheral edema obscures arterial pulsation, and a tight probe records venous pulsation in finger that compete with arterial pulsations. So that ends our discussion, and I hope you've learned a lot about it. As you move along in your journey as a nursing student, you will be exposed to a more in-depth learning regarding your oxygen saturation. Just to remind you to familiarize yourself with the different machines, especially when you go on hospital duty, because as you've seen in the pictures, there are a lot of these vital signs machines, and each hospital may have a different machine than the other. So again, all the best, and may God bless you all. Goodbye.